Oh my goodness, I love coming to this meeting. It's like my favorite of the year. There's so many good friends and colleagues that I get to meet with. In terms of like the intellectual highlights that we've seen so far, recognizing that the whole meeting's not over yet, we still have one of my favorite days coming up tomorrow, which is the Kidney Cancer Day. But there's been a lot of great data already presented. So yesterday we had some, in the initial oral abstract session, we had some great data presented about PARP inhibitors. You know, there still is this ongoing debate about getting back to the PAPMET question, is combination therapy with PARP inhibitors plus hormone therapies a more effective strategy than just sequencing them and doing PARP inhibitors by themselves and separately doing novel hormonal therapy? So in the BRCAAway trial that was presented, we saw, again, it's a relatively small study, but there was some pretty strong, compelling data, especially in the context of the other published data, that there really might be something to this combinatorial strategy with PARP inhibitors plus novel hormonal therapies in biomarker-selected patients. So that was really rewarding and interesting to see. Shortly after that, one of my good friends and colleagues and mentors, Niraj Agarwal, presented the CONTACT-02 trial looking at Cabozantinib plus Atezolizumab versus the alternative novel hormonal therapy for patients with metastatic castration-resistant prostate cancer. That was a wonderful study to see and data presented. I was particularly intrigued by the results in the patients with liver metastases. We know that these patients predominantly have particularly aggressive disease, and none of our standard of care treatment options really work or are applicable for them except for platinum-based combination chemotherapy, which means these patients have a very poor prognosis and very limited treatment options. And the treatment did particularly well for those patients based on the Kaplan-Meier analysis that was presented for that subgroup. So that was really exciting to see. It was far better data than I was anticipating, at least for those patients. We can argue the data about other patients, but for that subset, I was particularly delighted to see the results. So there's been a number of other presentations and data, but that's been particularly exciting. Some things that I'm really looking forward to seeing over the next day and a half is, I'm excited to see our data that we are presenting about Pembrolizumab and Cabozantinib in metastatic bladder cancer for patients that are cisplatin ineligible. It'll be very interesting to see, what everyone thinks about that data. Given the significant efficacy of Enfortumab vedotin plus Pembrolizumab, I'm not necessarily expecting this combination to move forward, but what I'm hoping is to create a space that we see there's a place to do targeted therapies like Cabozantinib and others in metastatic bladder cancer. These patients desperately need new treatment types to really improve the poor prognosis for these patients. I'm excited to see the overall survival data tomorrow for KEYNOTE-564 adjuvant Pembrolizumab. That's going to be pretty exciting to see, to really help us understand what the role or place is for adjuvant immune therapy for patients with localized or locally advanced kidney cancer.